Hum do, Humare Do. I'm talking about Uttar Pradesh's push for a two-child norm. That's part of its proposed population policy. I'm sure you've heard it in the news. How can anyone find fault in measures to control population in Uttar Pradesh? It's one of India's most populous states with terrible social indicators. I'm Anubha Bhonsle, and on Newsworthy this evening, Self and Pallavi are going to outline some pros and cons, some facts and myths about this move that, by the way, many states want to follow. Let's start first with the gist of what is Uttar Pradesh proposing. Number one, nudge couples towards a maximum of 2 children. Great. Incentivize those who abide. Great. If they stop at 1 child, even better. Give them quicker access to government schemes, promotions, paid leave in government jobs, houses, water, you name it. Those who don't, as in they have 3 children, penalize them. So no promotion in government jobs, no subsidies, no contesting of local body elections. And bring down the total fertility rate, or TFR, of the state. Now, what is TFR? It's the average number of children born to a woman. Uttar Pradesh wants to bring it down from the current 2.6 to 2.1 by 2026. Actually, Uttar Pradesh is expected to achieve this target by 2025 even without this policy. Now, many of you have left us notes saying this is good. We need to bring our population down. It's the starting point to all ills, and you're right. Past experience, data, and experts have laid out what happens when there are these coercive measures, these incentives and penalties to stabilize population, as in you penalize people for having more children. The first likely fallout is that there will be an increase in unsafe or sex-selective abortions and female infanticide, because there is enough evidence, and I'm sure you know, about preference for sons. So you end up distorting the sex ratio. One marker Uttar Pradesh says it actually wants to improve with its latest policy. Uttar Pradesh also wants to incentivize male and female sterilization in the latest policy. Great. This line is part of multiple population policies. The reality is the burden of contraception and family planning is still considered largely the woman's job. There is widespread aversion to vasectomy, kamzori aati hai, you will hear, and low condom use. When you put a coercive family planning policy, you're likely to end up increasing female sterilization. Remember those camps of female sterilization where dozens of operations were carried out in a matter of hours, conducted with utmost brazenness, all to meet some targets? So incentivizing male sterilization in this country is not going to happen because of a policy. Now to the incentives and penalties, which has actually led many of you to say that this is aimed at those with large families, i.e. Muslims, who have larger families than Hindus on average in Uttar Pradesh. Now, one way to think about this is to understand how these incentives and penalties are going to act out. Will people have less number of children because they would be denied promotion? Are our welfare systems so robust that people will have access to a government subsidy because they stopped at 1 child? Think about who's likely to be promoted in government jobs if they did stop at 1 child. How many Muslims have government jobs? How many people from economically weaker sections of society actually get government subsidies? We are guessing you know these answers.
So UP's policy could end up being more performative than real. The 2.1 TFR would be reached, but they were going to anyway. And in the process, many communities could now face an added stigma. Since Uttar Pradesh has announced its policies, many states want to follow suit. MP at 2.8 TFR, Assam at 2.3, Gujarat at 2.2, and oddly, Karnataka at 1.8 TFR want to consider a similar population policy. They are all BJP ruled states, which could be a coincidence, but the odd part is that the last two, Gujarat and Karnataka, they don't really need much course correction. So are we saying that our large growing population is not a matter of concern, or those thinking of large families do not need to be made more aware? They absolutely do, and our population is a matter of grave concern. But as the Chief Minister of Bihar, another populous state, has said, laws alone can't help. In the last 3 decades, at least 12 states have brought in population control policies in different formats. 4 have revoked them, while others' success has been questionable. What has worked is solving for the problems that lead to people having large families they cannot provide for in the first place, which means solve the unmet need of family planning, ensuring access to quality family planning services, increasing options for contraceptives. An expert once joked to Anubha that we have more cereal brands in this country than female contraceptives. Data suggests that when we focus on improving maternal mortality or infant mortality or education for girl children, all of it adds up. Telangana, Tamil Nadu, Kerala and Punjab all have a lower TFR than the national average of 2.2, and they achieved those without coercive policies. And states with higher TFRs than the national average, they are likely to be underdeveloped. These include Bihar, UP, Jharkhand and Madhya Pradesh. So all of this is to say that population needs to be sorted out, yes, but how we choose to do it is what matters. Tell us if this has been helpful, if you need more. We'd also urge you to look at the stories on our IG handle Newsworthy with AB all through this week. We are a part of Pari's reportage on population and stories on the reality of family planning across India, and we'll showcase them. Also a reminder, if this work is worthy of your time, head to the bio and make a small contribution to us to help us keep doing this unbossed and unbiased. I am Pallavi Prasad and I'll see you very soon. If you have been listening, thank you so much for your time.